Stress affects all systems of the body, including the musculoskeletal, respiratory, cardiovascular, endocrine, gastrointestinal, nervous, and reproductive systems. Our bodies are well equipped to handle stress in small doses, but when that stress becomes long-term or chronic, it can have serious effects on your body. Respiratory system. The respiratory system supplies oxygen to cells and removes carbon dioxide waste from the body. Air comes in through the nose and goes through the larynx in the throat, down through the trachea, and into the lungs through the bronchi. The bronchioles then transfer oxygen to red blood cells for circulation. Stress and strong emotions can present with respiratory symptoms, such as shortness of breath and rapid breathing, as the airway between the nose and the lungs constricts. For people without respiratory disease, this is generally not a problem, as the body can manage the additional work to breathe comfortably, but psychological stresses can exacerbate breathing problems for people with pre-existing respiratory diseases such as asthma and chronic obstructive pulmonary disease (COPD), includes emphysema and chronic bronchitis. Some studies show that an acute stress, such as the death of a loved one, can actually trigger asthma attacks. In addition, the rapid breathing, or hyperventilation, caused by stress can bring on a panic attack in someone prone to panic attacks. Working with a psychologist to develop relaxation, breathing, and other cognitive behavioral strategies can help. Stomach. Stress may make pain, bloating, nausea, and other stomach discomfort felt more easily. Vomiting may occur if the stress is severe enough. Furthermore, stress may cause an unnecessary increase or decrease in appetite. Unhealthy diets may in turn deteriorate one's mood. Contrary to popular belief, stress does not increase acid production in the stomach, nor causes stomach ulcers. The latter are actually caused by a bacterial infection. When stressed, ulcers may be more bothersome. Bowel. Stress can also make pain, bloating, or discomfort felt more easily in the bowels. It can affect how quickly food moves through the body, which can cause either diarrhea or constipation. Furthermore, stress can induce muscle spasms in the bowel, which can be painful. Stress can affect digestion and what nutrients the intestines absorb. Gas production related to nutrient absorption may increase. The intestines have a tight barrier to protect the body from most food-related bacteria. Stress can make the intestinal barrier weaker and allow gut bacteria to enter the body. Although most of these bacteria are easily taken care of by the immune system and do not make us sick, the constant low need for inflammatory action can lead to chronic mild symptoms. Stress especially affects people with chronic bowel disorders, such as inflammatory bowel disease or irritable bowel syndrome. This may be due to the gut nerves being more sensitive, changes in gut microbiota, changes in how quickly food moves through the gut, and/or changes in gut immune responses. Male reproductive system. The male reproductive system is influenced by the nervous system. The parasympathetic part of the nervous system causes relaxation, whereas the sympathetic part causes arousal. In the male anatomy, the autonomic nervous system, also known as the fight or flight response, produces testosterone and activates the sympathetic nervous system, which creates arousal. Stress causes the body to release the hormone cortisol, which is produced by the adrenal glands. Cortisol is important to blood pressure regulation and the normal functioning of several body systems, including cardiovascular, circulatory, and male reproduction. Excess amounts of cortisol can affect the normal biochemical functioning of the male reproductive system. Sexual desire. Chronic stress, ongoing stress over an extended period of time, can affect testosterone production, resulting in a decline in sex drive or libido, and can even cause erectile dysfunction or impotence. Reproduction. Chronic stress can also negatively impact sperm production and maturation, causing difficulties in couples who are trying to conceive. Researchers have found that men who experienced 2 or more stressful life events in the past year had a lower percentage of sperm motility, ability to swim, and a lower percentage of sperm of normal morphology, size and shape, compared with men who did not experience any stressful life events. Diseases of the reproductive system. When stress affects the immune system, the body can become vulnerable to infection. In the male anatomy, infections to the testes, prostate gland, and urethra can affect normal male reproductive functioning. Female reproductive system. Menstruation. Stress may affect menstruation among adolescent girls and women in several ways. For example, high levels of stress may be associated with absent or irregular menstrual cycles, more painful periods, and changes in the length of cycles. Sexual desire. Women juggle personal, family, professional, financial, and a broad range of other demands across their lifespan. Stress, distraction, fatigue, etc., may reduce sexual desire, especially when women are simultaneously caring for young children or other ill family members, coping with chronic medical problems, feeling depressed, experiencing relationship difficulties or abuse, dealing with work problems, etc. Pregnancy. Stress can have significant impact on a woman's reproductive plans. Stress can negatively impact a woman's ability to conceive, the health of her pregnancy, and her postpartum adjustment. Depression is the leading complication of pregnancy and postpartum adjustment. Excess stress increases the likelihood of developing depression and anxiety during this time. Maternal stress can negatively impact fetal and ongoing childhood development and disrupt bonding with the baby in the weeks and months following delivery. Premenstrual syndrome. Stress may make premenstrual symptoms worse or more difficult to cope with, and premenses symptoms may be stressful for many women. These symptoms include cramping, fluid retention and bloating, negative mood, feeling irritable, and blue and mood swings. Menopause. As menopause approaches, hormone levels fluctuate rapidly. These changes are associated with anxiety, mood swings, and feelings of distress. Thus, menopause can be a stressor in and of itself. Some of the physical changes associated with menopause, especially hot flashes, can be difficult to cope with. Furthermore, emotional distress may cause the physical symptoms to be worse. For example, women who are more anxious may experience an increased number of hot flashes, or more severe or intense hot flashes. Diseases of the reproductive system. When stress is high, there is increased chance of exacerbation of symptoms of reproductive disease states, such as herpes simplex virus or polycystic ovarian syndrome. The diagnosis and treatment of reproductive cancers can cause significant stress, which warrants additional attention and support. Stress management. These recent discoveries about the effects of stress on health shouldn't leave you worrying. We now understand much more about effective strategies for reducing stress responses. Such beneficial strategies include maintaining a healthy social support network, engaging in regular physical exercise, getting an adequate amount of sleep each night. These approaches have important benefits for physical and mental health, and form critical building blocks for a healthy lifestyle. If you would like additional support, or if you are experiencing extreme or chronic stress, a licensed psychologist can help you identify the challenges and stresses that affect your daily life, and find ways to help you best cope for improving your overall physical and mental well-being. Thanks for watching. I hope you found this helpful. Kindly subscribe to our YouTube channel for more videos like this.